Should I get a hair transplant now that I've stabilized my hair thinning with PRP? 23 years old. I've managed to stabilize my thinning hair with PRP. I've had 6 treatments over the course of the past year until now. However, the cowlick on my right temple has basically been there my entire life. But once my hair began to thin, then it was more than noticeable. I'm looking at a hair transplant along the hairline, focusing mainly on the cowlick. But I know the risks of getting a hair transplant so young can pose some problems in the future. However, if I were to do the transplant, I would continue the PRP every 6 to 9 months.
Thank you for your question. You've submitted several photos and you state in your question that you're 23 years old and that you've been undergoing PRP or platelet-rich plasma treatments, and it appears that your hair loss has been stabilized, and you are specifically concerned about the temples, particularly the right temple, in an area where you have observed a cowlick that's become more visible, and you're asking, is it appropriate for you to consider hair transplant, although you are still young, if you were to continue doing PRP every 6 to 9 months moving forward? Well, I can certainly share with you how I address this type of question in my practice, which we deal a lot with. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Hair transplant and hair loss treatment has been a major part of my practice. And I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system we developed starting about 7 years ago to help men and women of all ages treat hair loss non-surgically. And this is actually using PRP as well as acellular matrix, something that I'll discuss further momentarily. So I would like to explain to you a few things about your situation that still makes me hesitant to ever consider a hair transplant for someone your age. To begin with, you have to understand that hair loss is a progressive condition, and the age of onset and rate of progression are the most important variables when it comes to strategizing a surgical intervention. So what does that mean? Well, when you think about it, there's a concept known as the rule of decades. And the rule of decades basically is that when you're in your 20s, 20% of men have hair loss, while 80% do not. And as you get older, you get into 40s and 50s, it gets closer to 50%. So when we think of hair loss, I like to think, especially when we're doing what we do in our practice, a treatment called hair regeneration, I think about, well, I've looked at patients in a way retrospectively over the many years we've been doing this, and essentially I've categorized people into different levels of risk in terms of progression and a relative aggressiveness. So when you think about someone your age group starting to lose hair, essentially by definition your hair loss is more aggressive. This is in distinction to a man who comes in who's in his 40s or 50s who has a similar appearance. That situation, the hair loss, is less aggressive. Now, the aggressiveness of hair loss can be variable. For younger people, people in their 20s, men, I've observed that essentially you can have a progression that is very rapid, or where you can be practically bald or not bald by your early to mid-20s, as well as moderately progressive in terms of the time that it goes on. So you can be well into your late 20s and early 30s and still have a decent amount of hair. Now the challenge is in categorizing people in a way so that you can develop an appropriate prognosis, but unfortunately the appearance can be very similar in the more aggressive as well as the moderately aggressive situations at any given point of time when people come initially for a consultation. So when we think about the technology of PRP and what we've done in our practice with hair regeneration, PRP, which is now becoming much more well established as an intervention for hair loss, is still a treatment that is in effect slowing down progression. It's not stopping progression. When you think about hair loss treatment as it stands today, whether it's medical, such as the drug finasteride, whether it's PRP, whether it's acellular matrix platelet-rich plasma combination that we've developed called hair regeneration, as well as transplant, what are you essentially doing? You're essentially managing hair loss progression. You're not curing. So when we developed hair regeneration, and it's something that may be worthwhile considering in terms of your research and learning about this technology, what we've learned is that the effects of combination of acellular matrix and platelet-rich plasma formulated and injected in a particular way depending on an individual's particular hair loss characteristics, we're able to establish significant prolongation of growth as well as reactivation of the hair that isn't growing, as well as thickening hair that was previously thinning. Now, something to also be mindful of is whether or not it is worthwhile for you to consider being also on a DHT blocker, such as finasteride. When I look at people in terms of this relative aggressiveness model, I think a lot about their relative DHT sensitivity. Now, DHT is not the only cause of hair loss. We know this because when people are on finasteride, and they're on finasteride for 15 years or more, well, a lot of the patients can still progressively lose hair. But what I would suspect is that they really they have more hair than they otherwise would have had, but what's happened is the progression was slowed down. So again, when you think about this concept, with hair regeneration, what we have done is we've developed a system where we can do an injection, a single injection, and in the right candidate, we can extend the lifespan of that hair and see improvement for more than 5 years. We have a subgroup of younger people who have more aggressive patterns, who it appears that we can extend only 2 to 3 years. There's a distinction there, even with something as effective as our treatment. So the take-home message here with the PRP is, the PRP may appear to have stabilized your hair loss because you're not losing hair currently, but you don't know how long this effect is going to last. There is no treatment that stops hair loss for the rest of your life. It is still about managing hair loss. So in your situation, you're only 23, you don't know whether this PRP treatment will still be as effective 2 years from now, 4 years from now. And what I recommend to my younger patients is do everything you can to avoid a hair transplant for as long as possible. Hair transplant is not the answer to everything. Hair transplant is limited. It's limited by the amount of hair that you can get from your donor area, and just getting a natural, full volume appearance. For example, if you want to treat your temples, just think about what would happen if you got the transplant and then the temple hairs that were present currently receded. Then all you would have would be transplanted hair, and that does not look very good. So I would recommend that you wait for as long as possible. Certainly continuing the PRP treatments seems to make sense in your situation. Learn about hair regeneration, PRP acellular matrix, which we developed from a wound healing concept, and also consider a DHT blocker like finasteride. And as I said, I'd say wait as long as possible before considering hair transplant, and I would recommend probably not until your 30s. So I hope that was helpful. I wish you the best of luck, and thank you for your question.